Hi, this is Healthcare Now Radio's Trending Now. I'm your host, Jared Johnson. Join me and my guests as we discuss the latest topics that are in the news or getting social media traction in the universe of healthcare and health IT. It's a fast-paced 30 minutes, so sit back and listen as we kick off the show with what's on trend now. Today, our theme is interoperability for a purpose. And to help me, I have a special guest with me. Would you please join me in welcoming Doug Tolley? Doug is the Chief Revenue Officer and Head of Strategic Partnerships at Dedalus. Doug, welcome to Trending Now.
Thanks, Jared. It's good to be here. I appreciate the opportunity.
You know, we always like to just help our listeners get to know our guests a little bit better. Could you share with us what you'd like our listeners to know about you and your background?
Absolutely. So I've been in sales and sales leadership for about the last 25 years. In healthcare specifically, over the last 12 years, I've worked at Class Research, which is a healthcare research company in Utah, and worked there for about a decade off and on. And starting last July, I had the opportunity to come to Dedalus, as you mentioned, the head of strategic partnerships, and recently promoted to be the Chief Revenue Officer for our North American operations.
Outstanding. Now, what about anything else personally or professionally? If somebody just meets you on the street and they're like, hey, Doug, I heard this one thing about you. Is there anything else that you usually share with people when you're just getting to know them?
Yeah, I have a large family. I have 7 children. My wife and I are now empty nesters. We live in the beautiful state of Utah and love to do outdoors things, hiking and skiing and going to sporting events, a lot of boating and water skiing and wakeboarding in the summertime. I've enjoyed living here in the Western United States for all of my life and just love to be in the outdoors. So you'll either find me outside or doing something with one of my grandkids. But I graduated from BYU with an MBA in 2017, and my undergrad is at the University of Utah in biology. So I've been kind of science guy since I was a teenager. So I love science, I love healthcare, and I love sales.
That's a good combination, I got to tell you. What about one of the best pieces of career advice you've received? When we've been asking people this recently, I find it fascinating because, first and foremost, it seems like everyone is at least just evaluating where they are. And that doesn't mean they want to make a move, but a lot of people are just reconsidering, I think, the balance in their lives. And it's good for us to hear, I feel like, from those who've had some success out there, what's gotten them to where they are. And anything that comes to mind when I say, like, hey, what's something that you've heard or some advice you've received along the way?
I think there's 2 pieces that would probably be most top of mind, somewhat related, but kind of maybe interrelated. The first one is early on in my career, I got introduced to David Allen's book, Getting Things Done. And the real gist of that book is to try to figure out every day and really every hour, every minute, am I doing the most important thing right now? And how do I make sure that I'm utilizing my time and my resources, my team, whatever that is, to the best of my ability to do the right thing right now and to not get distracted by all the other things that come up. A lot of people like to play business. Not everybody likes to do business. So getting things done helps me stay focused. The other one I think that is just a quality that I look for anybody who works on my team is just be insatiably curious. Always ask, why do we do it that way? And why do we look at things that way? And how could this be better? And what else could we do? And I don't know, the other day I was reading a book and it mentioned something about a particular kind of suffering in Buddhism. And I thought, I know nothing about that. And I went out and I bought a couple of books on Buddhism. I started reading about that. It's actually helped kind of shape some of my interpersonal thinking. I think if you're good at being organized, and a lot of salespeople are not, they make this excuse that I'm not a good details person or whatever. I hate those kinds of excuses. If you're good at being organized, you know you're doing the right thing right now that's most important, and you're insatiably curious, I don't know how you can fail. I think those 2 things together are an absolute winning combination.
That's great. That's great. And it's not just one part of it there. It's the interplay between those things, like you were saying, that helps you succeed. Love that.
Absolutely. So my journey in healthcare has been that way. I knew nothing about Dedalus as a company. I learned about them. I liked them. I went out and made contact with them. At Class Research, I didn't have a specific specialty area of researching. I was one of our generalists and worked with private equity. So I had to kind of know a little bit about everything in healthcare IT. And I think it's that curiosity to understand how things work and to really understand how they fit together that's been part of the secret to my success or opportunities that have come my way, is really just being a lifelong learner and insatiably curious.
For sure. Well, and it comes through right here. And I will tell you what, I want to get into this topic of interoperability. So we're going to start with a trending topic related to this. So there's an article, and I want to get your thoughts on this, but I've seen a couple of headlines on it, but there was an article in particular that was recently published in Healthcare Finance News. It was on February 24th, and it was about how interoperability is improving overall, but rural hospitals are still lagging a little bit behind. So this article went on to explain that the number of hospitals engaged in integrating patient health information into EHRs grew by 40% since 2017. And that's according to the ONC, the Office of the National Coordinator for Health Information. So as of 2021, the stat that they shared was that 88% of hospitals engage in electronically sending and obtaining patient health information, though through either querying or electronically receiving a summary of care record. So 88%, that's great. That was a 40% growth since 2017. And then it also showed that rural hospitals are a little further behind, but this is one of those, I had to read into it to make sure that the headline didn't overly hype the difference there. And the fact is, it's not that different. Rural and small hospitals' rates of having information available at the point of care increased to 48% in 2021. So again, nationwide, we're seeing 88% of hospitals overall. Rural and small hospitals, it's less than half. So there is a disparity, and yet I still want to make sure I'm telling the whole story here, right? So the article went on to explain what's the impact here. And it talked about how hospitals' improvements in interoperability could be attributed in part to the initial implementation of health IT provisions from the ONC Cures Act, the final rule there, and adoption of the 2015 edition certified technology. So you talk about the certification program itself and its influence in getting that overall number up. But I think it's really coming down to those one-on-one interactions of how does that impact a clinician's experience as well as a patient's experience. And I think that's really where I'm okay, what's my takeaway? What's something that I take from this in terms of something that can impact a day-to-day task or a project that I'm working on with somebody? And so I'm curious what you think about this article in particular, about the trend, and whether it aligns with what you're observing.
It's a great question. And one of the things that we studied at Class Research extensively, I happened to be there at the really early stages of electronic medical records really hitting their heyday, and every hospital system was buying some sort of electronic medical record. And then there was lots of conversations over the last decade about, how do you integrate EMR1 into EMR2? And these exchanges were built. And then, conglomerates like Care Equality and Commonwealth came about, and they said, well, everybody's going to be able to trade data with everybody. And the reality of it is this. For an individual patient, my father has passed away, but I was one of his primary caregivers as he had stomach cancer a few years ago. And the reality of it all was this. His primary care doctor worked at a hospital down the road from where he lived, and that doctor used Epic. But that primary doc used Cerner in their hospital. Pardon me. His oncologist worked in a different hospital group. Of course, his insurance covered both. It was not a big deal. But that doctor used Epic. Then, related to his age and some of the other things, he had an ophthalmologist who had a completely different system that wasn't Epic or Cerner. He's going to physical therapy to try to keep his muscles moving and his bones. And he was, in his 80s, and they had a different system. And the reality of it is that as electronic medical records have become ubiquitous, and they're getting more and more there, that article talked about how some resource constrained areas like smaller hospitals, critical access hospitals, rural hospitals where they don't have as much money have lagged a little bit behind. But that's really not the point, because everywhere my dad went had an electronic system of some kind. But as somebody who's trying to coordinate care for my father, none of those systems talked to each other, and none of the apps that I downloaded were any good, let alone communicating that information to my sisters who lived out of state. Anyway, at the end of the day, what they're talking about in some of these articles is how good are we so far in the United States at the wiring and plumbing of these systems? The real question we should be asking ourselves is, what can we do now that we have these things wired and plumbed, right? What can we really do with that information now that we have these systems connected? So that does match with the trends we saw. I think most hospitals probably have some level of electronic medical record. Many of them can exchange with other organizations, but really seeing that work at scale, I think we still have a fairly long ways to go. And here's as to why. These systems, by and large, have been built to bill, not built to care. And I know that sounds like I'm condemning an entire industry, and I'm not. But electronic medical records and these systems are really exchanging information most of the time so that we get the ICD codes right, and we get the billing things right, and we do all of these other things. And when you look at clinician burnout, the reason why clinicians are getting burned out, and Class has extensive research on this as well as Harvard and JAMA and everybody else, it's really because they're using a system that isn't built to care. It's a system that's been built to bill. And that leads to the conflict and the difficulty for clinicians, for patients, for me trying to help my dad, and also at the end of the day, exchanging with other health organizations and exchanging with payers. It's because the whole system has been built from the wrong perspective.
I totally agree here. And there's a lot of different roads we want to go down here. And maybe the one to start off with is back to this theme that I mentioned at the beginning of interoperability for a purpose. I feel like that means personally, you were able to liken that and apply it to your personal experience as a caregiver for a family member. And I think that's the unique thing about healthcare and health IT is that we can always do that. Not everyone in every industry has a personal relationship with the industry, but that's the case in healthcare. So that is like, if anyone wonders what is the standard, well, there's a personal standard that we each have in terms of, well, it should be better than this. And the experience really could be improved in these ways, despite usually the top quality care that's actually given. And I think that's an interesting part to mention here. So interoperability for a purpose, in my mind, indicates the need to continually have that destination in mind. So with all this digital transformation that's been happening for a couple of decades now, all the things that we're building, I love the analogy of the wiring and the plumbing, like you said. Now we have to remember, what were we building on top of that? So I'm curious what that phrase means to you, interoperability. So
before I got into healthcare, I worked in the telecom business, and we had a company that put fiber optics and Cat 5, Cat 6 wires into the walls of a building, right? And it's interesting because you can't see those wires for the most part. You see the jacks and the plugs, but you don't see the wiring and all of the cables that are running through a building. The best part of our job, though, was to say to a building owner, well, we've got you all wired and plumbed now, essentially. You've got internet everywhere. What do you want to do? Well, we need a phone system. Awesome. That's the end point. That's where a human interfaces with the internet, right? Or we want to build an AV, room in our conference room. We want to have speakers and cameras and all of these things and lighting controlled and all that. And we're like, okay, great. That's where the humans are now interfacing with the internet. There was a purpose to all of that wiring. The wiring's kind of not interesting. It's what do you want to do now that you have everybody connected? Well, I think the same analogy applies to healthcare. So you say, okay, so we've now built it so these disparate systems can now all talk to each other. For what purpose? And I think it really was interesting during COVID. And I don't know how many people paid attention to this. I was watching press conferences from the White House, like a lot were. And I did a little study on the internet. And, because all of our systems aren't the same system, like in other parts of the world, you might have a citywide or a statewide or even a countrywide medical system, right? And so then they're all on the same system, right? So most of one time, most of the country of Singapore was all on Epic. So it was easy for them to trade data around, right? And whole states in Australia, whole big swaths of Germany and France and England are all on similar systems. So it's easy for them to exchange data. Because we don't have that here in the United States, during the height of COVID, as they were looking at deaths and they were looking at infection rates and all of those things, hospitals were faxing into Health and Human Services, faxing daily reports into Health and Human Services from hospitals. You say, wait, time out. The fax machine hasn't been a cutting edge technology for what? 30 years. I don't know how long it is. I haven't studied this. It's probably 30 years. And yet we have all this wiring and plumbing, and we're still faxing in reports to, the Department of Health and Human Services. So you kind of say to yourself, well, what are we doing all of this for? And it's got to be, we have to reset ourselves and say, we're doing it so that we can provide better care to the individuals receiving care. We're doing it so that the clinicians can have a better experience. We're doing it so that care overall improves. It's the quadruple aim. We talk a lot about the quadruple aim in healthcare, but we haven't really figured out how to execute the quadruple aim in healthcare. And I think that's what the promise of interoperability is, that we'll make it better for the patients, better for the hospitals, better for the clinicians, better for everyone. But we need to do it with a purpose. Like, why are we doing, again, I hate to say it again, why are we doing all this wiring and plumbing? And it better be for a purpose. So let me give you a really quick example. I think one of the things Dedalus is super proud of is a hospital that we work with down in San Antonio, Texas, called the Multi-Assistance Center. And the Multi-Assistance Center is a purpose-built hospital for individuals with special needs, mostly children who have cognitive needs, they have disabilities, they have all kinds of challenges. And most of those are very complex healthcare cases. One family I talked to just a couple of months ago said that they had 22 different medical specialists that helped in the care for their daughter. So it's much more complex than you or I for the most part. 20 plus clinicians and organizations helping in their daughter's care. Well, this group in the Multi-Assistance Center said, we can do better. So they brought in all of the specialists that you might need: an ophthalmologist, a dentist, a primary care doc, physical therapy, occupational therapy, groups for the blind, legal assistants, all of these people, dentists, all these people into one building, 34 different specialists, and then 120 community-based organizations outside the walls of the hospital, all wired and plumbed together so that they can share and coordinate the care for these individuals. And again, we're really proud of the work, but Dedalus was able to do all of that interoperability for the purpose of making sure these individuals that walk through the door of that hospital got comprehensive, complete, whole person care, and that they were really well taken care of. We also make it so that it's possible you can bill on the back end, but it wasn't built to bill. It was built to care. And by doing that, we've shifted the equation 180 degrees, that it's all about taking care of whatever that individual needs. In fact, they have concierge level service. When you walk through the door, someone can meet you with an iPad. They begin the assessment process with you and your family, and they're your care navigator for the rest of your life. And it's just a beautiful thing they're doing. It's a beautiful whole person care orchestration. Again, because it wasn't our vision, it was their vision. But their vision was, how do we take care of this whole person with all the care they need for the rest of their life? And, billings, tertiary or quaternary, it's way down the list of things that they care about. They're just trying to take care of the people. That's what interoperability with a purpose means to me.
That's fantastic. If you're just now tuning in, I'm Jared Johnson, and you're listening to Trending Now on Healthcare Now Radio. I'm speaking with Doug Tolley from Dedalus about interoperability for a purpose. Let's get back into it. Doug, I know part of interoperability in your mind has to do with the destination when we refer to digital transformation, like the overall term, right? So what is all that for? What is that purpose? And I've heard you describe that as being more clear that this really is the transition from fee-for-service to value-based care, that's part of this. It's one of the destinations.
Absolutely.
Can you speak to that a little bit?
So many of these systems, again, that are built to bill, or they're built to document, or whatever, again, people might be offended by the concept of built to bill, but let's call it built to document. That's still not really about care. But when you look at some of the things that are happening in retail health right now, where Walmart's getting into healthcare and Best Buy's getting into healthcare and Walgreens and CVS and some of these other organizations, what they're doing is they're meeting people where they are and giving them what they need. And that's completely different than some of these other models where, you go to the hospital and you sit in a waiting room and you wait for way too long, and then they move you to the smaller waiting room. And like that whole consumerism side of of what would we really expect from a great healthcare experience. Some of these other retail folks, because they understand consumers, because they understand buyers, because they understand that real quality interaction of what you want when you go to purchase something or when you go to buy a service, organizations like Amazon that totally understand the customer experience, one-click buying and all those kinds of things. Healthcare's lagged way behind on those things, but these introductions of some of these non-healthcare companies like Amazon and Best Buy and CVS and Walgreens and others, they've really changed the equation and they really changed the conversation. So when you ask about, what does that really mean around digital transformation and what does that end result in value-based care mean? Value-based care is a really good term. I want care that's based on somebody providing me some value. I don't think I have great experiences most of the time when I go sit in a doctor's waiting room or I'm in a cheap hospital gown sitting on a piece of, I think Jerry Seinfeld says, sitting on a piece of butcher paper, waiting for the doctor to come in and tell me what's wrong with me. That's not a great experience. As we make this transformation, though, from fee for service, which, built to bill, built to document, whatever, to a place where they say, who are you? What problems are you having as an individual? We take the word patient out of the equation and talk about a client or a peer or a consumer, somebody who's invested in their own health. Then how together are these professionals and me going to work together to make me as healthy and as happy as is possible within the framework of the current system? And it's possible to do that, but it's not possible to do that when healthcare feels transactional. I come in, you diagnose me, you write me a script, you put it all in the electronic medical system, and I go away. That's very transactional. I think what has to happen is that it has to become more of we're working together on the health of the individual. And the greatest cohort, population health, interesting concepts, but the best cohort in healthcare is not a cohort of 8,000 stomach cancer patients or 3,000 breast cancer patients. The best cohort is one. It's me. And it's me and my care team and my doctors and nurses and others figuring out how to help me be better. Sometimes in digital transformation, we think of, moving large iron and changing big systems. What we should really be talking about is how are we going to make the individual experience world-class? And then working from that end backwards, we can figure out what tools we ought to use to make it all work better.
Exactly. So I think one of those tools is what you mentioned previously is a system that's built to care, not built to bill. Can you tell me a little bit more about that concept?
Yeah. So, Dedalus around the world, not in the United States, but around the world, we're a big EMR vendor. I mean, we have 6,500 hospitals that run our system of record. So we understand the electronic medical record world. But again, to me, that's like table stakes. Okay, so now you have the data. What are you going to do with it? What are the endpoints? How are you going to make scheduling better? How are you going to make self-scheduling better? What's your telehealth strategy? Which tons of consumers love telehealth because I don't have to put my kids in a car and drive across town and maybe it's snowing and then I go wait in the waiting room and maybe they get sicker sitting next to the other kids that are sick. Like, how do we take all of those things and say, how do we build a system that's built to care for that individual as opposed to document and bill? And, America's litigious, so we've got to make sure we cover all the bases and then you're signed all the forms. And, all of that mundane stuff doesn't have anything to do with caring for an individual. So I think the difference in a system that's built to bill versus built to care, it's not one piece of software. It's an ecosystem of tools that make me feel like I have a part in my own healthcare. The caregivers have a part in my healthcare. We're all working together to do things differently and better. I'm getting good advice. I'm actually taking some responsibility myself for my own healthcare. I think it's an ecosystem built so that health and wellness improves and that well-being improves, as opposed to, and I said it before, as opposed to this, what has felt like for decades, pretty transactional. I go in, you tell me what's wrong with me. You write me a script. I walk out. I go to the pharmacy. end of transaction. And that's not really the way healthcare works around the world, to be honest with you. In other places where medicine's a little bit more socialized, it's all about how do we keep people out of the doctor's office? How do we keep people out of the hospital? Because those systems, because they're single payer, and there's a whole other conversation we could have, right, Jared, that's completely different. But those systems are built to figure out how to care for people more than just have this transactional feeling we have in American healthcare today. So
I love that. All right, I'm going to give you a final word here. Anything we haven't talked about yet?
I don't want it to sound like nobody's doing this, because we are seeing some really great stories around the country in organizations who are really doing things differently and really changing the paradigm. So there are a lot of organizations who have moved a long ways down towards being accountable care organizations and moving towards value-based care. I think that's more than just a buzzword now. I think it's actually coming to fruition. We just need to accelerate that. And I know it's difficult from financial models and a whole bunch of other things, but that's really the true future of healthcare. I think COVID helped bring that to the forefront. I think I mentioned some of these retail health people are helping to sort of force that conversation. I think some of these major acquisitions like Amazon buying One Medical and some of those other things are helping driving the conversation forward. And then there's organizations out there who are really putting dollars and money and effort and really smart people behind this. I just don't think it's going to come from the healthcare IT vendors. I think it's going to have to be driven by healthcare organizations who are innovative and consumers who demand a better experience. And then some of these outside forces are forcing us to change the way we think. I'm optimistic, but I think it needs to go faster.
Thanks for sharing that. And with that, that's a wrap for this episode. I want to thank my guest, Doug Tolley, for joining me. To learn more about Dedalus, find them at dedalus.com. That's DEDALUS.com. You can learn more about today's show on our program page at healthcarenowradio.com. And make sure you follow the show's hashtag at TrendingNowHC and follow me on Twitter at Jared Piano. Until next time, if it's happening in healthcare and it's now, it's on Trending Now.